Good afternoon, everyone. Thank you for joining us to celebrate the launch of the City Reports. My name is Alice Pomfret. I'm Research Officer at Correlation European Harm Reduction Network and also author of the City Reports. So I will be your moderator for the webinar today. We are joined by a wonderful panel of harm reduction experts who represent 5 focal points across 5 different cities in Europe. Together, we will discuss some of the key findings of the City Reports and explore the next steps for advocacy based on some of those findings. So it's probably worth mentioning now that we will have time for questions at the end, but do feel free to type your questions into the Q&A box at any moment. Panelists can respond directly to these questions via this function. And of course, please feel free to interact with each other in the chat. It's always nice to see who's connected and from which corners of the world. So please go ahead and introduce yourself. And please be aware that you do have 2 options when using the chat, so you can talk to either hosts and panelists or everyone. So just double check that you have the correct settings applied. So let's get going. As you can see on the screen, the City Reports are the final segment of Correlation's civil society-led monitoring of harm reduction in Europe, and this is for 2023. And you can see on the map here on the right that we've worked in cooperation with 5 different focal points. So we have Amsterdam in the Netherlands, Bălţi in the Republic of Moldova, we have Esch-sur-Alzette in Luxembourg, London in the UK, and finally Warsaw in Poland. So before we dive into each City Report specifically, let me first give you a brief overview of what exactly the civil society monitoring is and where the City Reports fit into that. So the monitoring is a collective effort and it counts on the crucial support of all of our focal points. We have 42 focal points in different European cities, and together with their vast expertise in the field, we map the development of harm reduction policies and programs across Europe. And this is done with the aim of enhancing the quality of life for people who use drugs and ensuring access to high quality harm reduction services. So following a new format for 2023, the monitoring report is being launched in 6 volumes. So we have Insights of C-Care, Essential Harm Reduction Services, New Drug Trends, the Mental Health of Harm Reduction Staff. We have the Teddy Reports, which is the Trans-European Drug Information Network. And finally, the final segment, which is the City Reports. So we use this data collected through the various monitoring activities to inform advocacy efforts, to advocate for better policy, to secure funding and enhance harm reduction planning and delivery. And the City Reports are actually a new contribution to the monitoring. So this is the first year that we're piloting this. So yeah, we're especially excited to share them with you today. So what exactly are the City Reports? So out of our 42 focal points that I mentioned previously, 5 focal points took part in the City Reports for 2023. And focal points were invited to nominate themselves, and following a series of meetings, 5 cities were eventually chosen. Now, a mix of capital cities and smaller cities were chosen to reflect a variety of contexts and populations and needs. And the reports are designed to serve as concise and accessible advocacy tools to engage decision makers at all levels. And this is done by either showcasing best practices or as an urgent call to action. And for each city, semi-structured interviews were conducted with various stakeholders, and that includes community representatives, policymakers, harm reduction service providers, and other relevant actors. And the information collected from these interviews allowed for a more nuanced understanding of what is happening at the local city level in a way that other methods such as online surveys can be more difficult to capture. So on the screen, you can find an overview of the selected focal points and the organizations that they represent. And we're thrilled to have them join us today as our panelists, each of whom have played an integral role as co-contributors to their respective reports. So during this session, they will each tell us a little bit more about their motivations behind selecting their topics, highlight the key findings or central themes from their reports, and finally discuss how the reports can contribute to their ongoing advocacy efforts in this area. So without further ado, it is my pleasure to introduce to you our first panelist, Machteld Busz, representing our focal point for Amsterdam. So Mac is the director of Mainline, who are a front runner in the harm reduction and drug policy field for over 30 years, and they're dedicated to improving the health and quality of life of people who use drugs. Mac is also the co-founder of Poppy Drugs Museum, which is a really wonderful initiative of Mainline that retells the story of drugs and creates a safe place to learn and talk about drugs. So Mac, I give the floor to you. Thank you.
Thank you, Alice. And you can control my slides, I think, yeah?
Yes, I can, yeah.
All right, great. Well, good afternoon, everybody. I can only see Alice and myself and the slides, so I have no idea who I'm talking to. I think there's around 26 people in the audience, so thank you for having me. I hope I can interest you and keep your interest during the lunch break. And thank you for the invite, Correlations, to present a bit on the Amsterdam situation. So yeah, for our city report, we chose to also introduce a bit of the national context, I think. Although the Netherlands always had a very progressive image where it comes to harm reduction and drug policies, in recent decades, this really changed. So in the national narrative, we see a lot of problematizing drug use and people really struggling with how to relate to drug use in society. This is because we've become one of the main producers in the world of several drugs. So in the Netherlands, most of you might know that we are a key producer of ecstasy, exporting that across the world. Same for cannabis and methamphetamines. We are an important hub, a transit country for especially cocaine coming from Latin America into Europe. And strangely, the Dutch also have a very large presence on the dark web. So you can imagine that this is causing a different outlook on drugs in society. The effects of the increased production and trafficking is that we see more organized crime. Corruption is quite rife, especially in the harbors, but also in other areas and institutes. This drug money that people are making with illicit trade is finding its way into the regular economy, and there's a lot of worries about that, about money laundering and how these finance affects democracy on a local and national level. And of course, with the production, there's also a lot of environmental damage. We see that in particular with the production of ecstasy, that waste is dumped in mostly nature areas, but anywhere. And of course, there's a lot of pollution associated with that. And all of this has affected our politicians, of course, and how they see drugs. We have seen in the last decades much more repression, people and politicians thinking, okay, we have to be tougher on crime. We had politicians say, well, it's because we've always been so tolerant towards drug use that we now have this problem. There's quite a moral outrage against people who use drugs as well. We have politicians in place that are relatively conservative at the moment. We have a strong populist wind blowing in the Netherlands. And a lot of conservative voices represented at the national level, much more, I think, than we see in the general public. So our national politicians are talking the tough talk. They're looking at repression. They're looking at increasing budgets for law enforcement, and they are looking at people who use drugs to blame someone for all the problems that we have in this respect. In the slipstream, what I find important to flag is that we also saw a neglect of the harm reduction infrastructure. So we have a lot of worries about whether we are ready for the new issues that arise in the streets. We have growing populations on the streets again with more public drug use, and the harm reduction infrastructure has definitely been suffered from budget cuts, and it's not as good as it used to be. Next slide, please, Alice. So interestingly, and this relates, of course, to the city reports, what we see on the national level is what you see on the slide on the left. So we see public campaigns in cities like Rotterdam, for example, where really the user, the person who uses drugs is being blamed for all the violence associated with drugs. There was this poster campaign. It says something like, there's blood on your pill. Your line of coke leads to his liquidation. So pretty tough, campaigns with absolutely no effect and no evidence base that might work. But our politicians really embrace this as a way forward to solve issues. We see, like I said, the investments in law enforcement to crack down on labs. and to fight all this, how do you say, containers of coke coming into the harbor, for example. Our minister here, you see her on the photo on the left, is visiting Colombia to talk about how we can, solve the issue as two narco states together. So I'm laughing, but it's pretty serious, this repressive, reflex. Now, interestingly, on a city level, we have Amsterdam, and this is, of course, the focus of our city report as well. And the mayor of Amsterdam is coming to very different conclusions than our national politicians. So what she is saying is, we have a big issue with production and trafficking, and regulation might be a better way to work on the problems that we have with this. She took a bold stand by organizing a conference in January about regulation of drugs. Harm reduction was very present on the agenda as well. And I think here you see that the national politicians, there's a disconnect between them and reality. And mayors on a local level have a very different outlook. They are dealing with different problems, much more urgent because everything is happening in their sphere of influence. And I think it's very interesting what's happening in Amsterdam against the tide, really talking about we have to discuss regulation as a different alternative option, compared to more repression. And next slide, please. In this space, for an organization like us and like-minded organizations and people like us, we're trying to find, of course, ways to push this agenda forward, to support the initiative that the mayor has. I think the city report is a good example because we basically documented what's happening and what were the key topics that were discussed in the conference. We're trying to figure out what are local options, what can you do on a local level to push an agenda that is more geared towards regulation. And there are things that you can do. I think what could be interesting is looking at substitution for cocaine, legal substitution treatments. You could look into different options to maybe condone certain things or have police use their discretionary power. You can see where you prioritize law enforcement efforts. There's also a pilot going on with regulated cannabis. That's mostly on the local level as well. So the local sphere of influence is an interesting one. We, of course, in this whole populist climate are keeping our hopes up with initiatives that might be possible on a local level. And that is, I think, what we have tried also with the city report to showcase what's going on in Amsterdam, to showcase that the debate on how to deal with drugs in society should be broader, less moralistic, more realistic, and more connected to what people think and feel and do in reality. So I'll leave it at that, and maybe Alice, you can lead the discussion on this.
Yeah, perfect. Thank you very much, Mac, for telling us a bit more about these really exciting developments that are happening at the local level in terms of drug policy in Amsterdam. And I think the conference that Mac mentioned, it really does signal a turning point in drug policy reform. And I think we really have lots to be excited about in terms of getting us one step closer to regulation becoming a reality, and not just in the realm of cannabis, but other substances as well. Yep. So Matt, just a quick one about advocacy. Have you thought a little bit about how you plan to use or share the report?
Well, we are engaging in quite close conversations with the city to see what could be possible as potentially a pilot that follows from the conference. So very practical, what can we do in reality? But there's also, of course, a lot of communication that you can do around this to follow up, the momentum that the conference created. And this is something I think that the city report can help with. There's quite some people in the city that are trying to push this agenda. I think the mayor is quite committed to move further on this topic, and hopefully she will speak out over the course of the coming years. And I think it helps that we document what is going on, and that we keep pushing what is possible and how can we actually collect evidence of what would work. So hopefully the report will help and support that effort and see what is possible at the city level, and that might inspire other cities and hopefully in the end also national politicians, of course.
Wonderful, thank you, Mac. And it's worth adding here, I think that Correlation has recently launched a new European City Initiative, which will bring together mayors, policymakers, civil society representatives, and affected communities. And the idea is to really elevate the importance of city-level actions in those global reform efforts. And this will include the addition of a mayor's panel at this year's European Harm Reduction Conference in Warsaw. So I think Hannah can drop some details in the chat if you are interested in finding out about more. So it's now time to introduce our next panelist. So we are moving to the city of Bălţi. So I would like to introduce Alla. Alla has more than 20 years of experience in the implementation of HIV prevention and harm reduction programs in the Republic of Moldova. Alla is the president of the Union for Equity and Health and represents our focal point for the city of Bălţi. So the Union for Equity and Health has been working for many years with some of the most marginalized communities in the Republic of Moldova, including people who use drugs, people living with HIV and AIDS, sex workers, and formerly incarcerated persons. So Alla, please go ahead. The floor is yours.
Thank you, Alice. Hello, I'm happy to be here and to be part of Correlation. So now the world, well, the big world will know about my small and beloved city Bălţi, and I will start to tell you a bit about drug use in Bălţi. And this is a part of the report. In the beginning, the report reflects the epidemiological situation in Bălţi. So Bălţi is a very small city. It's a very small, referring to big cities in the region, in the north region of the Republic of Moldova, with 150,000 population. The estimated number of people using drugs in Bălţi is a bit more than 5,000, and about 3,000 drug users are receiving harm reduction services here in Bălţi. Also here we have a growing popularity of new psychoactive substances as in all Europe. And we estimated that around, and according to IBBS data, around 60% of people who use drugs are use new psychoactive substances, including teenagers. The epidemiological situation here is an alarming one because the prevalence of hepatitis C among people injecting drugs is almost half of the population. HIV prevalence in this group is a bit less than 15%, but 10 years ago the situation was even worse. It was more than 40%. So even just a half and a bit of people using drugs are harm reduction clients. We managed to decrease the level of HIV prevalence among them. And you can see on the slide also the prevalence of HIV and hepatitis C in general population, and we can see the huge discrepancies between the general population and people using with people using drugs. May you go to the second slide? Report for the Bălţi reflect two and address two main challenges: stigma and discrimination towards people using drugs, and the second one is drug registry. I will start to speak a bit about stigma and discrimination, and you can see on the slide one history, one situation. It's a life history of one of our clients. You can read, I will speak, you can read. I am sure you'll manage to catch all the information. So here in Bălţi, stigma and discrimination is generated by health and social specialists, and we have a lot of cases, you'll see. And this situation caused disclosure of information about drug use status or HIV status to relatives, to public institution, police officer, without the consent of the person. Also, this situation generates a big refusal from the part of people using drugs to access justice for resolution of their rights. for the resolution of the rights violation, wrongful data disclosure, termination of employment, or limitation of their parental rights. And of course, this causes mistrust in the health and social systems, social system. May we go to the third slide? And the second challenge documented and reflected in the report is the drug record, is the situation with drug record in Busz. And this is common for all the country, and not all for Moldova, but also for the region, I think. So drug registry here in Moldova, it's very similar with the Soviet model of drug record. It reduces the access to narcological care. And we see that we have just 5% of people using opioids involved in opioid agonist treatment in Moldova, from the estimated number of people. It causes unemployment. There are a lot of positions in the public sector, law enforcement, medical system, rescue services, incompatible with drug record, of course. And employment discharge upon employers finding out the status of a person, including a drug registry. So all of these are barriers in accessing drug treatment services, in accessing harm reduction services. And we can see in the report some reflection of this situation. For example, just 30% of people using drugs made an HIV test during last year. It's because the barriers they faced. So yes, we can move to the next slide.
Yeah, I think it's just these three.
Yes, but the report also provides information about paralegals work in Moldova as a good practice in the field of documentation and overcoming stigma and discrimination and barriers related to them. So we have a paralegals network, and the paralegals in Moldova are representatives from community of people who use drugs. They are peer-to-peer outreach, they are social workers, and they collaborate very close with the local harm reduction services and programs. Now we have 10 paralegals very active involved in the work, but this year we plan to increase the number. They will be 26 person in the field of HIV, and we will catch also 8 paralegal in the field of TB control, of tuberculosis, prevention of tuberculosis. They are offering primary legal assistance to their fellow community members, such as legal consultation, counseling, conflict mediation. And their work is organized by our organization, Union for Equity and Health, under the supervision of the National Council of Legal Assistance guaranteed by state. And each paralegal assists a minimum of 30 individuals in their community every month, recording personal and medical data disclosure for clients using drugs or living with HIV. And a huge part of their work is to facilitate referrals to public lawyers, to submit requests to institutions, to conduct public awareness sessions, and to organize community-oriented initiatives in the field, of course, of human rights. And since 2022, at least 24 cases of human rights violation have been documented, mainly involving family and specialist doctors regarding the illegal data disclosure. Of course, like every report, we have a list of recommendations, which I consider very useful, and of course, I will support the implementation at national level, because Even the report having focus Bălţi city, it's about the situation at the in the whole country. So we have a following recommendation: to conduct an analysis of how drug dependence and HIV-related data are handled across the medical facilities. Using the obtained data after this analysis, it will be important to implement mandatory training programs for medical professionals aimed to prevent the unauthorized disclosure of sensitive medical information related to drug use and HIV status. Another recommendation is to ensure strict adherence within service provision to EU and UN level quality standards. As we become a candidate country to EU, it's very important, and I think this our authorities, national authorities, will become sensitive towards this recommendation. Because this can prevent and deter healthcare professional from disclosing sensitive medical data, and will discourage them for any actions that may exacerbate the stigma and discrimination. And the third recommendation is to abolish the narcological register, the drug record. It's very important to review the current model of record, and this will improve the access to essential treatment and harm reduction services. One more recommendation is about decriminalization of the possession of drug for personal use. The current situation promotes stigma and discrimination, hindering access to vital treatment and harm reduction services, and not just harm reduction and specialized services, but we can speak about more general services as primary medical care and other type of services. One more recommendation is about provision of education to healthcare and other services providers regarding the specific need of people using drugs. A more informed health care environment can bridge gaps in understanding, reducing stigma, and improve the quality of care for population. And the last one is about the importance to allocate additional funding to support the work of specialized paralegals in Moldova, because they are an important chain in combating stigma and discrimination and all the barriers that people using drug are facing. Thank you. I really hope that the report will be interesting in reading. Thank you.
Thank you so much, Ala, especially for bringing attention to this incredibly important issue. And yeah, indeed, I hope that the report can contribute to the amazing work already being carried out by yourself and the Specialized Paralegal Network, and to help to alleviate some of the harms associated with some of these outdated and stigmatizing practices that still take place in Bălţi. So I am a bit wary of the time, but if you could just very briefly tell us about any plans or any opportunities that you see for advocacy.
Yes, of course. I am going to present the recommendation and the solution, because the report also contains the solution to the members of the National Drug Commission. And now we are working in 3 groups. One of the group are targeting such kind of situation, discrimination and stigma barriers faced by drug users. I'm going to inform the people using drugs community in Moldova, because they should know and they must have these arguments and these tools for advocacy for their rights. And I probably will contact friendly mass media and tell them about this report, I think they will be interested, and they will help us to promote the recommendation and to become stronger in our advocacy effort. Thank you.
Perfect. Thank you so much, Ella, for your contributions. Okay, so we move on to our next city and our next panelist. So representing Esch-sur-Alzette in Luxembourg, I would like to introduce Martina Kapp. Martina is the head of service at the Jugend and Drogenhëllef Fondation, or JDH for short, where she has worked for over 13 years. And since 1986, JDH has offered support and assistance to people who use drugs in 3 different cities in Luxembourg, and that includes the provision of a drug consumption room, opioid agonist therapy, psychosocial support, and many, many other vital harm reduction services. So Martina, I pass over to you. Please introduce us to the city report for Esch. Thank you.
Hello, sorry. My name is Martina and I will present you the city report of Esch-sur-Alzette. I'm working as a head of service for the Fondation Jugend and Drogenhëllef in Luxembourg. The report is about establishing a drug consumption room in a small-scale city. And the name of the threshold center with drug consumption room and offers of medical care is Contact Esch. Sorry. What are which elements are important to establish a drug consumption room? The first one is working with the local community, Esch-sur-Alzette, a strong working together with this community and also with the ministry. That will mean we have to integrate their interest in our concept to design the Contact Esch. For example, we adapt the service rules and regulation to the interest of the public space of the city of Esch. And this all is possible with our strong culture of cooperation, which means that we have many meetings before opening the threshold center. And we are always in contact with the local community because we need their support, or when we have trouble with the neighborhood, we need also the support of the community, Esch-sur-Alzette. Another element which is really important is the location of the threshold services. Normally, they're also always located nearby the station or in the center of the city. Here in Esch, the community Esch decided to situate us in a department of Esch where are living many families there and so on. And we have to respect that our location must be more invisible for the inhabitants of Esch. So we asked the community to get 2 agents of security who are monitoring the environment of Contact Esch. And it's really running well. Then one thing what was really inspiring us and in our work together with the community was the travel to Denmark, where we have seen 2 examples of drug consumption room. One in the capital of Denmark, there is a big consumption room, and one in a smaller town of Denmark, which called Odense, where we have seen a small drug consumption room. And this small drug consumption room inspired us really. And so we integrated some elements from there in our concept. But I think the most important thing is a strong political will of Luxembourg, and the supportive legal environment we have here in Luxembourg. It simplifies many things. We needed 6 years to establish and to design the contact Esch together with the stakeholders. And so I evaluated my personal propositions that you need to have to work together with the stakeholders. That is, remain respectful and professional, have endurance, willingness to compromise, act with statistic and concepts, and last and not least, other have knowledge too. I thank you very much that I can present this city report. I thank Correlation, and I hope I can inspire you to open also a drug consumption room in your country. Thank you very much.
Thank you so much, Martina, for providing us those really important details about Contact Esch and how it was to establish a DCR in a small-scale city. And I think it's encouraging to see Luxembourg's commitment to extending DCRs beyond the capital and across the country. So like you said, we hope that this report can serve as a catalyst for advancing the implementation of DCRs in other cities and towns across Europe.
I hope too.
Yes. And then just a quick one again, Martina, about have you identified or do you see any opportunities where the report can be useful for your advocacy endeavors?
Yes, perhaps it can, because we have discussion about the north of Luxembourg, where drug criminalization is increasing and drug users are staying in the town Ettelbrück, and perhaps this report can help us to convince the community of Ettelbrück perhaps to open the third drug consumption room, but we will see.
Yeah, let's remain optimistic. Thank you again, Martina. And it's also probably a good moment to just mention that Correlation actually hosts the European network of drug consumption rooms, and it serves as a membership-based civil society platform, which brings together organizations that are either currently operating or planning to implement a DCR, so a drug consumption room in Europe. And its goal is to improve the availability, accessibility, and quality of these services. So if you or an organization that you represent is interested in becoming a member, then Hannah will kindly drop the details in the chat. So without further ado, we will move on to our next panelist. And this is Shayla Schlossenberg. So Shayla is the Drug Service Coordinator at Release, the UK Centre of Expertise in Drugs and Drug Policy. Release provides free, non-judgmental specialist advice and information to the public and professionals on issues relating to drug use and to drug laws. Shayla represents London as the Correlation focal point, and they have spent the past 8 years researching and working in the harm reduction field across the US, the UK, and China, with a particular focus on people oppressed by patriarchy, people who trade sex, and people who use methamphetamine. So Shayla, the floor is yours.
Thanks so much. Thanks for the introduction. If we want to go straight to the next slide with the graph on it, I'll give my little spiel. All right, I'll try and be condensed because I can ramble. So yell at me if time's getting close, Alice. But to introduce, so Release is a national center of expertise, but we have always been based in London and running legal clinics in London. And so we're very happy for the opportunity to talk a little bit more specifically about London as a city. As an organization, Release says that we're pulled into two groups, which is people who use drugs and then people impacted by drug laws and drug policies. And sometimes those groups are overlapping and sometimes they're not, which we're going to talk about today. At Release, we take a sort of structural analysis approach and understand that drug laws are used as tools of control that maintain various forms of oppression of people. And these tools are used to different degrees on different people in different areas and communities. So for example, we're looking at the northeast of England, different from London. the northeast of England is actually the capital of child removal. Children in the north of England are 70% more likely to face care processes, be removed from their homes and their mothers. And this is a type of like classist control that's most often done through drug policies around mothers using drugs. We're not going to talk about today because we're talking about the London report, but I just wanted to give an example of like other manifestations that happen nationally. In London, we focus on two areas in the report that are sort of maybe some of the more visible ways when you visit London of the ways that drug laws are actively hurting people and communities. And so the first that we'll talk about in a second is racist policing and racist drug law enforcement. And then also sort of anti-homelessness and classist policies, which actually directly contribute to the disproportionate death rates from drug use amongst this cohort of people. On the sort of racist policing component, there's loads of different evidence from different really good organizations. The graph here actually comes straight from Metropolitan Police data on stop and search and arrest rates per 1,000 people by ethnicity in London. And you can actually look up Metropolitan Police data, and there's dashboards that you can play with both by the police, which obviously take with a grain of salt in terms of how they collect information, but also various sort of monitoring nonprofits. But stop and search on the street by police, significantly more likely to be stopped and searched if you are Black. I think in the year 2021, 1 in 5 young people of color was stopped in London. And it has been a trend since we started collecting data on stop and search in 2007 that there has been heavy racist disproportionality, most intensely towards Black people, but as well towards Asian and mixed people. And if you were to look this year at the London specific data, Black and white people by the numbers have been stopped in like the same numbers. But when you think about the fact that Black people are only 13% of the London population, why have the same total number of Black people been stopped? And we also have reports that Black people use drugs actually less than white people in London based on many data that we have. So we know that there's ongoing racist disproportionality. And this isn't just who's stopped on the streets and searched for drugs or searched for other things, although the vast majority of searches in London are for drugs. This also then permeates to who gets arrested when something is found, and also the types of outcomes that people have in the criminal justice system. So all the way through, more severe consequences are most experienced by Black people in London and in the country. I don't think I have anything else with this. We'll go to the next slide. And so this is a quote actually from a formerly incarcerated person who's a person of color who lives living in London and got in touch with Release when he was having trouble with the criminal legal system. So he says, I've been stopped and searched numerous times, of course, nothing on me. And you think, why am I being stopped? It's usually, oh, there's a robbery in the area, you fit the description. So, you know, whatever. Or like I said, in all honesty, I did grow up in a highly active gang area. So that's a factor as well, if I have to be honest. But the biggest thing that stood out to me was more when you're in the system and it's like, wow, I swear to myself, like 85% of the people in here are Black. You know what I'm trying to say? And he goes on to say that he has white friends who did use drugs without any sort of fear of criminal legal involvement. Or that even if they were caught by police, that nothing farther would happen to them. And sort of statistics on drug law enforcement do back this up. So this isn't just a deep dive in the numbers, like this is a daily reality that is very much felt and recognized by individuals. We talk in the report not only about how this is experienced by people of color in terms of policing, but also how people with histories of rough sleeping, or even just people that make a living on the street or who panhandle as their main source of income, like also experience different forms of antisocial behavior policing on the regular and understand how their perceived class also makes them targets for increased policing and daily police interactions and a greater likelihood of more severe like criminal consequences to drug laws. And so people all over have a general structural analysis, although they might use different language to describe it, of the ways in which systems of oppression are directly contributing to how they experience these consequences pertaining to drugs and drug law, regardless of if they have drugs on them or if they've ever used drugs or not. And then obviously that has a trickle-on effect to how people, if they would ever even feel comfortable to access services, will go about doing so. And we see that, for instance, in terms of the fact that half of drug-related deaths in England are people that are not in the drug treatment system. So there are people that might have benefited from receiving a harm reduction intervention, but because harm reduction is just situated within drug treatment services, by and large, people don't go into these services because they fear the surveillance and the even greater increased type of visibility on their daily lives, and the types of policing or criminal legal involvement that might come with that. And unfortunately, largely our drug services are not very responsive or understanding of the types of ways in which people are cognizant of these daily realities and how their own identities will contour how they move through public space and how they interact with police, and how they may or may not interact with services in the future. And so a lot of our recommendations deal both with changing the laws themselves that are these tools of oppressions on people's lives, but also asking services to be more aware, to be lower threshold as a way of being more flexible to those realities. If you are a service that doesn't ask people for names, that doesn't ask people to show some type of form of ID or a date of birth, like people who are more surveilled will feel more comfortable accessing it. That's something probably most of us on this call and involved with correlations know, but unfortunately it's not the reality for the way a lot of services currently operate in London. And so we both need to scale up and resource harm reduction services that are genuine harm reduction, by which I mean low thresholds. And we also need to just actively remove the tools of different bans on drugs. We've recently banned nitrous oxide here. So again, that's farther criminalizing young people who are already very likely to be the people stopped and searched by police. Reversing some of the antisocial behavior laws that we have that allow the overt criminalization of homelessness and of poor people. And so at the same time, stripping away the things that are harming people and also trying to resource people with services if and when they want, in order to build more healthy and resilient communities. Would be honest, and there's the sort of cluster of recommendations.
Yes, thank you, Shayla. I think it's always so important to highlight how drug laws have been and continue to be tools for perpetuating racial and class discrimination. And I think what's particularly alarming in the UK context, is that despite an overall decline in stop and search practices, there's an alarming increase in disproportionality.
That's
and
right.
Yeah, it hits communities of colour the hardest. So I think it drives home the point that while surface level statistics might seem promising at first glance, there's often deeper issues of discrimination at play. So thank you so much. And can I ask you if you how you plan to use the report for advocacy?
Yes, perfect. Thank you. Sorry, I was meant to say that in my original spiel.
That's all.
So I'm of two minds, if I'm fully honest, insofar that right now, politically in London, we're in like a strange situation. We're going to have a general election this year in the country. It's looking likely that Labour might win, but the Labour government that will come in is actually a sort of tough on crime type of Labour government. There's been talk about increasing policing on the streets. There might be increased funding for drug services, but that doesn't necessarily mean that they won't still be abstinence or higher threshold services. And so rather than using this in the traditional sense of trying to change sort of like policymaker minds as like the first stop, using this more as a tool to like build coalition with other social and racial justice groups to be like drugs and drug policies like are something that everyone needs to care about if you care about justice or if you care about human rights, as opposed to like sort of the more narrow health framing that drugs are often thought of in this country. That'll be the type of advocacy that this report would sort of fall into for us, and trying to build stronger partnerships and solidarity in order for us to have a more comprehensive strategy on how we're going to keep different oppressed communities safer in this time.
Perfect. Thank you so much, Shayla.
You're very welcome.
So we are, last but certainly not least, I shall give the floor to Magdalena Bartnik, who is the Executive Director and founder of the Precursor Foundation for Social Policy. So Magda acts as the correlation focal point for the city of Warsaw in Poland and has worked in harm reduction for over 15 years as a project coordinator, practitioner, and co-author of research projects. Established in 2011, Precursor is an NGO operating in the field of human rights protection, public health and drugs policy, and dedicated to protecting the lives and improving the health of people who use drugs. So please go ahead, Magda, and introduce our final city report of the 2023 cohort. Thank you.
Thanks very much. I will try to be brief. So I'm gonna tell you about Praga district, which is the oldest part of Warsaw, which survived the devastation of war. And it has been falling into despair for many, many years. with very poor technical conditions of the buildings and many abandoned buildings. And also many facilities, treatment facilities and facilities for people experiencing homelessness. And there has been a clustering of treatment facilities continued for many years. As you can see at the graph, which shows the OAT programs in Prague, the number of them significantly increased just in 2022. It was around less than 1,000 patients. But now when you look at how many people are in OAT, so in Warsaw itself, it's 1,500. And in Prague, which is the smallest district, it's already 1,200 people in the treatment. I have to point out that the OAT itself, so the people receive medication, but there is lack of psychosocial support and other offers that would be needed. Next slide, please. So we have in Prague what it looks like the 90s open drug scene. So there's a street where there's drug dealing and also drug use around OAT programs. Harm reduction services and harm reduction outreach we conduct is limited because of low capacity and not enough resources. And you know, the not really acknowledging harm reduction, and we feel that we are just being left alone with this in this crisis. So also, you know, the very important thing is the lack of comprehensive support for marginalized populations, meaning there is OAT, but we lack social support services and also homelessness facilities for people who use drugs. They are not, they can't really stay at the shelters because they are using drugs. So we would need a specific services for homeless services for our clients. But also there are new challenges and needs that we face. There are many people who came to Poland and to Warsaw from East and also from Ukraine due to the war. So there are many people there in need, but there is also a need to have a specific services for immigrants that they could reach and get help. Next slide, please. There is a local community resistance, a very strong one, and it's actually not just towards people who use drugs and addiction treatment facilities, but also towards other facilities and services who are targeting marginalized populations. There's absolutely a lack of dialogue and communication between municipality and other stakeholders. So what you see at these pictures is the way that the district acts. So the building you see, the empty building at one photo, it was a place where people stayed and they gathered. Then it was destroyed and now it's gone. So the places that our clients gathered and where we could conduct outreach are already changed, they are not existent. And this is the strategy of the city and district, to chase away people who use drugs, to destroy and demolish, facilities and buildings that they use to survive. And at this moment, it's really difficult to establish a dialogue and to have this round table to really discuss how to deal with this crisis. Thank you.
Thank you so much, Magda, for sharing your reflections about what is a very complex and multifaceted challenge that's happening in Praga district. And I think the points that you made underscore the necessity of having that roundtable dialogue and engaging all relevant stakeholders to formulate evidence-based solutions and not to just implement police crackdowns and the demolition of buildings, as we have sadly recently witnessed in Praga. So yeah, we hope that this report draws much needed attention to the issue and encourages policymakers to address it seriously. And on that note, how might the report support your advocacy efforts in this area? Have you identified any opportunities?
Yeah, so there is a big chance to establish this, dialogue, to make decision makers want to speak with us. Basically, this is our aim at the moment. To present our needs and the situation. Also, the report is the situation assessment and needs assessment, which was lacking. So the European Harm Reduction Conference, which will be held in Warsaw in December, will be a good occasion to talk about it in the panels, but also not in just the official settings. And also the city network that you, Alice, mentioned could also begin this process of talking and discussing how the drug-related problems could be addressed, to make decision makers and authorities responsible for the situation and not just, not treating this in a serious manner. So I would say these two events and these two actions would probably really a good occasion. And on the more local level, within organizations and civil society, together, then we can just move forward with trying to make people understand that this is not a situation that can be addressed just by having one harm reduction outreach service. It has to be comprehensive, and there has to be a cooperation between every single stakeholder.
Yeah, agreed. Thank you, Magda. And it's nice that you mentioned the conference, because I think not only is it an excellent opportunity to further spotlight the Warsaw Report in its local context, but more broadly, I think it will be a major event in the realm of harm reduction and drug policy. And if you do wish to register for the conference or submit an abstract, there will be details in the chat. And we are pleased to share that Correlation will be offering a number of scholarships for community members, junior researchers, and harm reduction workers and activists. So we really do encourage people to explore this opportunity and submit an application. So thank you once again to all panelists for sharing your reflections. I will stop sharing my screen. I haven't had a chance to look at the Q&A. Let's see. I see there's no open questions. I have a few questions that I would like to pose to some of my panelists, if that's okay. Unless anyone wants to raise their hand and ask anything now, now's the time. Okay, I was wanting to ask Shayla actually a little bit about the harm reduction hub that's going to be implemented in London soon. Could you share a little bit more about that?
Sure, thank you. So in January, Release launched a fundraiser to open up what we're calling the Harm Reduction Hub, which should be open very soon now. We're aiming to soft launch it the Monday after next. We'll open the doors and put out a chalkboard to start inviting folks in. But it is just a small harm reduction center based in the Release office that to start will offer drug testing kits. So we have nitazene testing strips, fentanyl testing strips, and xylazine testing strips, because we have a lot of nitazene and xylazine showing up in different drug supplies here right now. And we'll be selling reagent kits for a variety of different drugs that are like multi-use kits. And doing sort of like one-off, both legal and sort of harm reductionist health advice on a walk-in basis. So no name, You just sort of come in, have a chat, and it's a sort of living room model. So when you walk in, there's just couches and tea and coffee, and you can just sit down, plug in your phone, have a chat if you want to have a chat. Trying to cultivate a sort of living room model of you can have services if and when you want, or there's just something readily there for you when you need it, as opposed to the sort of current model I was discussing where you kind of go and have to register for a service to then access the sort of information that should be low threshold to get. So we're trying to create ourselves a model for what low threshold can look like, in hopes that then that itself will become an advocacy tool where we can promote that approach by other services around London and other places as well.
Amazing, thank you. And yeah, just to congratulate you and Release on the amazing work that you've done in that area. I think it's much needed. I've just been made aware in the chat that someone raised their hand during the webinar, which I didn't see. So is that person still here, and do they wish to ask their question now? I don't know the name. Hugo Faria, are you still here? No. Okay, well, looking at the clock, I think, yeah, I won't keep you any longer. So I hope that you've all found this session to be both informative and inspiring, and yeah, leaving you with plenty to think about. And I'd like to extend a massive thank you once again to our wonderful panelists for their contributions today, and also for their contributions to the city reports overall. A special shout out to Hannah, our communications officer, who's been behind the scenes handling all of the technical parts. And finally, a huge thank you to everyone who joined as participants. So for those eager to check out the reports, they are now available on the Correlation website. I believe the links are in the chat. They are all available in English, and most are available in local languages. And if not, they will be there in the coming days and weeks. So yeah, I hope that you have enjoyed it. If you have any questions, feel free to reach out, and enjoy the rest of your afternoon. Thank you.